All right. Well, thank you everyone for being here today. I'd like to take this opportunity to welcome our amazing speaker, Malabika, and thank you, Malabika, for joining us this evening. I wanted to also take a moment to introduce her. It's my distinct honor to introduce Professor Malabika Sarkar, an esteemed implementation researcher and expert in mixed methods science. Professor Sarkar is a physician with a master's in public health from Harvard University. Over her 30-year extensive career, she has notably spent a decade leading community-based programs at BRAC in Bangladesh, the world's largest NGO. At BRAC, she founded the Center for Excellence of Science and Implementation and Scale Up and served as the acting dean in 2015. Professor Sarkar's prolific contributions to the field include over 150 peer-reviewed publications, six book chapters, and she secured influential roles on numerous international advisory boards, including the Lancet of Global Health, the World Federation Public Health Association, Medical Research Council in the UK, and VHRP Alliance for Research Capacity Strengthening, among others. Her expertise is widely recognized and is reflected in her memberships with prestigious organizations. And we are honored to have Professor Sarkar sharing her insights with us today. Please join me in warmly welcoming um, Professor Sarkar. Is there some feedback, or are you able to hear me all right? You able to hear me okay, Bethany?
There's a little feedback, but I can hear you fine. Thank you.
Oh, okay. All right. Thanks. Yeah, and Malabika has been a wonderful colleague. She's now our Associate Dean of Global Engagement, and she's going to be doing some amazing work for Brown University and getting us our presence globally. And she's going to be enriching the Brown name all over. So, really looking forward to seeing the work that she's going to be doing in this capacity. I'll now turn it over to Bethany and then Altagracia to introduce themselves.
Hi, thank you so much. I'm excited to be here. So I reside in Rhode Island, Western Rhode Island, near Connecticut, and my background professionally is in education and more specifically in neurodivergent populations and working in therapeutic interventions, school-based interventions, curriculum design, educational testing. And then I also have a passion for yoga and as it applies to medicine. So I'm a yoga medicine therapeutic specialist, and I've been doing outreach in hospital settings for about 7 or 8 years now, where I've gained so much wisdom, experiential wisdom, which is what made me passionate about pursuing my degree here at Brown in public health and trying to bridge that gap between education, science, healing, and school-based interventions that have efficacy. So I'm so glad to meet you, Dr. Sarker. Thank you.
Nice to meet you too.
Hello, my name is Altagracia Soto. I'm also a public health student at Brown University. I have a medical background. I studied medicine in Dominican Republic. There I saw, I was exposed to a different public health system. I kind of shifted gears and focus on pediatric clinical research. Some of the projects that I lead and support include like childhood obesity, medication compliance, and implementation of social determinants of health, particularly in the NICU population. And I'm very passionate about public health, and I'm very excited to be here. I'm currently residing in Massachusetts, and in my free time, you can find me with my golden retriever. Her name's Misha, so that's a little bit about me.
Well, thank you both. Malabika, I don't know if you had any words you wanted to share before we dive right into the question.
No, that's okay.
All right. Okay, take it away, moderators.
Let's start with the first question. So my question is, I was very impressed by your academic background, and I wanted to know how your background shaped your focus on community-based research and implementation.
So background means like my education background, or?
Yeah, like the trajectory being like a medical background and then pursuing an MPH and then a doctorate in Germany?
Okay, so all these are kind of an accidental, not planned, because my career was shaped, I would say, significantly by my personal life. So the reason I'm here in the public health, maybe because of my bad marriage. That's the truth. So I I got married after high school. And then I went to med school when I was married, and I had my son when I was in second year medical school. So after finishing the medical school, the plan was I will be a clinician. So I did the training as GY, obstetric and gynecologist. But because my relationship was not good, I decided to leave um, uh, my husband. So I left, and I was wondering what I'm going to do as a clinician. And it's not very also like a socially acceptable that time in 90s. I came from a educated middle class Hindu family. So that time, one of my colleagues told me that BRAC, this NGO, received huge grant for maternal mortality reduction and family planning program in rural Bangladesh, in the northern district of Bangladesh, and they're desperately looking for a female doctor. That was in 1991. Female doctor, because no female doctor in Bangladesh wants to go to the village and stay there. And I felt, oh, this is a golden opportunity, kind of an running away from the society. So I went there and I started working as a community-based physician. And frankly speaking, I loved that. I never enjoyed my clinical life. Even I never enjoyed my medical school. I always wanted to study physics or maths because my husband wanted me to be a doctor. That's why I went to med school. So and I fell in love with the public health in the community because the 4 programs I was working as a community-based physician. One is maternal mortality reduction, family planning, tuberculosis, acute respiratory infection treatment, and nutrition program. So that was a very comprehensive, that holistic approach in public health, the community-based intervention, working with the community health worker, working with the frontline health worker, also the health facility. So that's kind of my public health career started. And from there, when I was working, I was fortunate because the BRAC has a very strong relationship with Harvard. So one of the Harvard professor, my lifelong mentor who passed away last year, I do think many of you might know him, Richard Cash. He's one of the father of this oral rehydrating saline in Bangladesh. So he visited BRAC. He used to go to the BRAC regularly and met me and told me, why don't you apply for an MPH? I said, why? I said, Harvard. I said, okay, I'm not sure. But he said, no, apply. I think you have worked 4 years intensively in the field. We need students like you. So I applied. I got some tuition waiver. And then 95, I came to Harvard for my public health. So it's like my first half of my life, the public health practitioner was learning by doing. And then I had been exposed to the academic public health at Harvard. And in 95, I came here to do my MPH. Yeah. So that's kind of my life trajectory to the public health.
Nice. Thank you for sharing. It's interesting how things in life just shape
Yeah.
future. All right, I'll leave it to Bethany now.
Dr. Sarker, I think that you've already sort of spoken to this a bit. Our next question was, how did serendipity play a role in becoming who you are? And you sort of offered a little bit about this golden opportunity that presented itself amidst a little bit of difficulty. So I feel like you've already started to illuminate this a bit. But if you could add anything, how do you feel serendipity has shaped your path?
I think it's combination of both serendipity, but also my focus, because what I have done in my life, and I share that with my students and the young professionals, that most often when we start a career, we think about what am I going to be in 5 years or 10 years. To me, that you are on a ladder, the step, and you're looking upwards, that in 5 and 10 years, where can I go? And what should I achieve? Like, how can I be successful? But what I have done in my life, like even still now, that I focused on the step I'm on it. Because to me, my philosophy was that if I focus too much on the top, I might flip over and fall down from the ladder. But if I focus on the step where I am in and try to learn and contribute and work hard, I'll go to the next step. And it's true, I'm not boasting. That was my focus, and sometimes I get surprised at how I became a professor of Ivy League University, which I never dreamed of. And with that different corner, when I was kind of in my journey, that I met so many people who contributed or who touched my life as a guardian angel, different person. I could not be here without support of those. And I'm very grateful to that. And my favorite movie is It's a Wonderful Life. I don't know, Christmas movie, whether any of you watched that. It's 1940s movie. And it's the philosophy of that movie is that we are touched by the people, intentionally or unintentionally, they touched our life and our life changed. And the third thing I would say, that I was always very much open, even still now. I consider myself as a lifelong student, so very open to learn, open to listen to others. So serendipity definitely played a role, because there are so, like, Professor Richard Cash, my friend who navigated me to come to the public health, to go to this rural village, my uncle who paid my accommodation and 1/3 of my tuition fee at Harvard, who is a professor here in the USA. Yeah, so definitely, but it's combination of all. But serendipity definitely played a role.
I love that. Thoughtful. Thank you. Our last question here in this section that we had for you was, do you have any advice for a younger you exploring doctoral programs and applying to these graduate schools that you wish you would have known then, that you know now?
Yeah, because I'm strongly, like, with my experience, last 25 years in the academic, that I discourage my students to go for PhD just after finishing masters. I do think that you need to know that do you need a PhD? What where heart is. You want to be a practitioner, go to an organization, or you want to be a researcher. And the only way you know that, if after finishing the master's in public health, you work. So even if you work in an organization, are you interested in analyzing the data and doing more research, or you want to make a change? And that period, minimum 2 years, I think is very important, because going for a PhD is a very, I would say that commitment. It's not only the time, it's the energy, it's an investment. So if I look at my, like, younger myself, I do think that I should have done a little bit of more research before I start my PhD, my doctorate. Yeah. So I heavily discourage, even today, one of my students, I was discouraging her that don't go for PhD now. She's finishing MPH this year from Brown. I said, no, what do you want? Because as a woman, it's also more important, because our reproductive, like, if someone choose to be the mother, or to have a career, or have a partner, get married. These are the decision, whether we like it or don't like it, shaped by the society. And we need to be a little bit careful when we make those decisions.
Thank you.
Thank you. Our next question is, Dr. Sarker, your academic background is impressive and spans internationally. I think the question has already been answered. What shaped your journey? Is there anything else that you would like to add while you went from your MPH to your PhD?
MPH to PhD, or later. I think like network is very important, networking.
Mm.
And giving value to the others that who can advise you. Don't have to take every single advice, but it's always, I found that in my life that few things that I screwed up because I did not discuss with several my colleagues or the friends or my peers or my gurus, even with my son. So it's very important to have a conversation with others because that helps you. As I say, that you don't have to accept everything, whatever. You can make your own decision. So in my life, I always try to listen to others, and I'm a risk taker. So whenever I had the opportunity, I took it. I'm not a person think too much that what is happening. Or what is going to happen. So whenever there's an opportunity showed up, I just grabbed it. So when I went to Germany, the PhD was in Burkina Faso. So option was I could have done the secondary data or go to Burkina Faso in a Francophone country and collect primary data. And I decided to do that. I didn't know a single French word, and it was in a rural village. Even most of the people don't speak language. But I thought it will be interesting to know and to collect primary data, which will make me a better researcher, because when we collect the primary data, it's not only the technicality of the data, it's also the whole experience of the data collection, the partnership with the researcher of that country, and interpretation of the data, understanding the cultural context of that, because the data is number. But interpretation of the data is the most important skill for a researcher. If you can't interpret the data, it's useless. So I'd say that, yeah.
Thank you. It seems like your journey was shaped by many people in that trajectory, and you take in everybody's advice, and if the opportunity comes, you grab it. So yeah, thank you.
Yeah, the opportunity, but also I engaged in, and I did not kind of limit myself to do my work. I always tried to do more than that, what I supposed to do outside my technical work. So even if when I came Brown, you can't believe that how many committees I volunteer for everything. Most of the things, if I can do, if I can learn. So I would say that don't try to start an account book or log book and then say that, oh, if I do that, I might do whatever you love. And then you'll see that that will facilitate your journey and you'll reach somewhere. But don't, even in personal or professional life, don't start your logbook. Life does not go according to the logbook or, accounts book.
Thank you, Dr. Sarker. I feel like that advice really resonates. And two, I have a personal philosophy that I always say to myself, when something comes up and it's unexpected, then it feels scary. I have an expression that I always say, like when a door opens, or for me, it's when God opens a door, I walk through it. And so I was reminded of when you were speaking about being a risk taker and all that you were saying.
Because the challenge makes you resilient. Life is more interesting when there's a challenge, and every experience has a silver lining. One can learn from it.
Yes, I agree. Thank you. So our next question starts to ask you a little bit about a challenge, perhaps a challenge that you faced along this path of your career, and how that sort of shaped your journey as well.
Different kind of challenge. Although I did have some personal challenges coming from a middle class family as a minority in Bangladesh. So there are a lot of social limitation for a woman to have an independent career. Then I was a single mother, so with a son. And there are challenges as a woman in every. This women have more challenges maybe than men. I don't think that men have less challenges. And then if you are women from a low-income country, as a single mother, there are a lot of challenges. But it's important. All challenges are perspective. So there are some challenges. Is like, if you think of the financial, of course, that my that first job was $50 a month. I had to manage with $50 a month with a single mother with my son. That's also interesting how to how can manage your life. But there are social stigma. There were social challenges. Relative in the workplace, definitely gender played a role as a woman. But what I have done actively, even as a younger, when I was young until now, I always try to kind of bond with other women. So, to support each other, and sometimes it might not sound very politically correct, but I don't pay much attention to the gender discrimination because I don't want to be kind of an over emotional about, oh, they are discriminating me, because sometimes it pushes us from the work we are doing. So for me, it's very important that what I'm doing, I have to do it better. I know the quality and then volume of work, maybe sometimes it's more than the man, who knows that. But second is that how can you build that partnership or relationship with other women in the institution? And it helped me a lot. I do think I progressed this much and did not feel much about the gender discriminated because I was always surrounded by wonderful women and I needed help, and I built the partnership and I tried to create the environment when I was senior at even the Brack University, when I became professor or associate dean, that how to create an enabling environment to work as a group, as a women, and also as a team, that men and women. And every challenge has its silver lining. Life is very monotonous and boring if there is no challenge. And that was my perspective always. So sometimes people get really frustrated with me that I don't complain much, but I'm not a complainer. So because I don't want to see myself, I have never seen myself as a victim. Every challenge, whether my bad marriage or as a single mother, going to Burkina Faso, I took it as an opportunity that which will help me to become a better person and learn more. So I think that's when we complain more, then we lose the essence of our life. So, but I'm always a pro the women or pro young people person.
I think that's beautiful advice. So this next question, I think, builds off of a little bit of what you were saying, because it looks at asking how you feel we should build trust, build relationships. And you started to make this beautiful point of talking about building bonds among women. Could you speak to that a little further around?
Yeah, any relationship with the other women or man, or male student, or irrespective of the gender, no relationship would start with a vested agenda. I think whenever we have a relationship with a vested agenda, certain expectation that relationship will bring some, benefit to us, then you can never create a trustworthy relationship. because the relationship have to be without any vested agenda, so that supporting each other, helping each other, and how can we be there for them, and also the fairness. So when I was in Bangladesh at BRAC and my team, I had 35 to 40 team members, and irrespective of the political ideology or the religion or the cultural, the dress code, it was very colorful in my team. Every day I go to the school and there are women with abaya, the women with wearing sari, there are my team member wearing t-shirt and jeans, there are men with the salwar kameez. I'm just giving the example, the man. So if there's no vested agenda and we are truly sincere and genuine, people are not stupid. They can see through. And that's the way that you can build the relationship, the trust, whether it's the professional partner or with your student or with your colleague or your peers. That not thinking about what I'm going to gain from this relationship. It affects your relationship, even not explicitly, but your body language, everything affected by that. So if we are genuine ourselves and reach out to the friends and have a communication, definitely it's always creates the trustworthy relationship. Same thing with the community too.
Yes, I was thinking as you were speaking, have you been in a position where you've really had to build trust to move forward with a public health sort of agenda? I know we live in a time where certain topics or themes require a bit of trust. Have you ever been in a position professionally where you needed to really build trust to move forward
Yeah.
a public health agenda?
Yeah, especially when in Bangladesh, when I used to work with the government, that the Ministry of Health, because or implementers always have this suspicious about the researcher, because we researcher have certain arrogance that we know it all and we are the researcher from the ivory tower. So when you, particularly for the implementation research, and when you need to work with the Ministry of Health, the colleagues or the colleagues in other organization, you need to build that trust. You need to, and to building trust, very important is respect. Because I found that sometimes we go to the implementer, whether organization or Ministry of Health, we think that we are the researcher, we have our PhD, we are the professor, we know it all. No, as a community health worker can teach you a lot. So whenever I worked, I should not boast about that, but I do know that most of the times I have a very good, transparent and trustworthy relationship, because it comes from the respect, it comes from the listening. So whenever I did the research with the Minister of Health or organization, BRAC or other UNICEF or the foundation, the other organization, my approach is that how could we be helpful to you? So for research, that not going with an agenda that, okay, this is you need to do. So that's the opening dialogue. And if we can bridge the gap between the implementer, the policymakers, and the researcher, the public health program will be very, very successful. Because, like, if you think that I published 150 papers, but if you ask me, Malabika, how many papers have really had impact? Not than 15 or 20. Rest are like published. So the knowledge translation, the knowledge we generate, and if we want to translate it, we need the support of our policymakers, whether it's the Ministry of Health or the NGOs or international NGOs. And if we can't build that relationship, and then all our research, yes, you can be, anyone can be Ivy League professor, and then 50 publication in Lancet, but how much it has an impact on the ground level, we never measure that. Our impact factor about how many people cite that paper, not how much impact that paper has in the ground level in terms of changing policy, in terms of saving life, in terms of very successful intervention, not. So that gaps need to bridge, and there, as a researcher, we need to take off our arrogance hat and I know it all attitude. I think that's very, very important, because I don't believe that as having a PhD and being a professor or researcher. Research is something, is the curiosity. It's like a critical thinking and analytical mind. And a frontline health worker in the primary healthcare could be as critical thinker as analytical like me. I have seen in my life many PhD, many professor, they published, but there's not much critical thinking or curiosity. So all those narrative need to be changed if we really want to have a good public health impact. Look at what's happening in the USA. It's a communication gap because we don't know how to communicate with the policymakers. You always blame them, but how do we communicate? The policymakers are not sitting there that when the paper published will be Lancet, I'll read that and I'll change my policy. No, I'm sorry. And when we publish, by the time any health policy in any country, the train has already left. Because you do start in 2021, then you collect the data, then you submit, then publication happens in 2023. The data is already old. The world of the public health or health has moved forward. New problem, new data, new information. So that's why I love implementation research, because it has the knowledge translation and knowledge broker component, where the responsibility for us, how to communicate, how to bind from the policymakers and the implementers, bringing them to formulate the research question, communicating with them, not 70 pages paper or New England Journal Medicine, but simple 5 minutes video or infograph, or translating that into the local language. We never do that. So I'm sorry it's the longer, but it's one of the topic I'm very passionate about. And I constantly say that there is a failure of the academics and researcher. And that's why the world is now, that there's so much miscommunication and misunderstanding and mistrust on the researcher, because we created that wall with the policymakers and the implementers.
Thank you so much. Your response was so thoughtful. It was enlightening. Thank you.
Dr. Sarker, in your opinion, what are the most important qualities in a public health leader?
The public health leaders, okay, so to me, the leadership cannot be trained. I strongly believe that one can be a good manager, one can be a good boss or supervisor, not a leader. There need to be some inherent quality in a leadership. So definitely there need to be the strategic vision. The leaders always need the strategic vision, but the human quality is very important for a leader. Whether it's the empathy, whether it's the equity, sense of equity, whether the people skill, because it's very easy to work by myself. Like, you can ask me to, I don't know, to do this and I can do, but making other people work is it's a very different task. So for a public health leader, the technical skill, understanding the problem, but I also think that public health leader need to be the politically aware, not politically engaged or active always, but aware the geopolitical, socio-cultural aspect of a context. Because only then, if you think of the public health leader, there are 3 types of public health leader. One is the public health leader who are in the public sector. If you think of the Minister of Health or Secretary of Health, there are public health leaders who are engaged in the delivery, the services, whether it's the health facility, the hospital, or NGOs. And they're also public health leader in academic setting, whether it's the Dean of the School of Public Health or other administrative position. And all these leaders need to be in the present to understand but human quality, the technical quality is easy to, it's not very difficult to have a technical quality, but for a leader, and the final thing, I do think that leaders need to understand the finance. I think the financial acumen is very important for a leader. Otherwise, when the leader's totally dependent on different colleagues, sometimes it can off track the strategic vision. So I emphasize more on soft quality in a leader, because the technical quality, most of the leaders have technical quality, especially in the academic setting or others, but the human quality and the soft skill, the soft qualities are very important for to become a public health leader.
Thank you. What advice do you have for someone who is getting their NPH in terms of choosing the public health area of specialization?
So mostly I don't know, but the Brown MPH program is very different than my teaching experience MPH in Bangladesh or Germany, where I'm teaching for last 25 years. Average age of, I think for online MPH is true, but not the in-person. So if someone, because there are two types of student comes for MPH. One is with a wealth of experience, 2 years, 3 years, 5 years, whether it's as a researcher or as a public health practitioner, and then they come for an MPH degree, they join, enroll in university, or just after finishing the undergraduate. So after MPH, there are two types of application. So one is that those who come with a wealth of experience, now they have exposure to all this academic knowledge. If you think about the epidemiology, biostatistics, even understanding social determinants of health, or how to design an intervention, how to do a clinical trial. And then those who are new, for them, it's all theoretical, because those who came with the experience, now they can match their experience, and they can see the alignment that what I have learned in the field or in my work and now in the academic. So my suggestion is for a MPH graduate, I already mentioned that go for work. And what type of work you want, I always encourage to go for some practitioner, to go and do work where there is the health facility, where there's the NGO, where there's the community-based organization, real life experience. And then decide that I would like to move to the research, to be a researcher, I would want to be a policymaker, or I want to be an activist, that implementer. But if it is possible, it's always good to have at least 1 year delivery, health service delivery or community-based organization experience, because that will shape you, that like you will know that what competency your skill you develop from your MPH course. And so it's kind of a bridge between your brain and your heart, the competency, skill, and the technical knowledge, and what you enjoy most. Because I know that one of my close friends, she did a PhD, wanted to be an academic, and came to the university, and after 1 year she quit and went back to the implementer organization. She says that I don't enjoy.
So this last question we have prepared for you, it's kind of like seems like a broad question that sort of highlights everything we've talked about, because it's looking at asking about superpowers, and so it kind of has like a fun tone. But just asking you, we'd love to hear, given your wide range of experience and even your beautiful knowledge that you've shared with us today, what would you attribute as your superpowers?
Okay. So my superpower is I'm a people person. So I love being connected with the people. My family says that I collect people in my life. I think that, and I try to navigate that my people skill different directions. So as an academic, my first priority or what I enjoy, not just the priority, what I love most as an academic is mentoring. Number one. Then number two is teaching. My happiness is over there when I'm either in the classroom or in the kitchen. These are the two places that I love. I cooking and then teaching. And the third one is the research. So you can see that research, I did a lot of research, I published, and but the research I love most is the methodological one, that I love thinking about like what methodology, but overall research is not, I don't enjoy much. I do that but I don't enjoy much. So my superpower, this is my people skill. I would like to kind of invest that people skill, especially for mentoring the young public health or non-public health professionals. So anybody writes an email to me, even in a high school student, I respond. Or anybody wants to meet me through the Zoom, or the undergraduate student or high school student or graduate student or postdoc, because in my life, I do think that in the few cases, if I would have had a better mentor, I don't regret, but I would have done a better job, because sometimes being a mentor, they come with the experience, which is tacit knowledge, which does not always come from the book, and guiding the young colleagues or sharing that experience, that's their decision, is very useful for the young professional, which normally you will not receive by doing a PhD or master's from Ivy League school or going to the top university. The tacit knowledge, the experience, a mentor, a senior can share with a junior, which is very, very helpful and useful for that person.
That's so nice to hear. I don't know if I qualify as young, but you might be hearing from me. I could always.
Oh, compared to me, you are young. I don't feel like old. I don't look like that old, but I'm not that young. So, so yeah, you can always drop me an email. And you live in Rhode Island, so
Thank you
we
so
can
much.
also meet in person.
That's what we have prepared for questions for you.
But
Yeah,
as we
I'm
have
the
time, those who are the student, if you have question, please ask me.
yeah,
Hi, Dylan.
absolutely. Dr. Sarker, nice to meet you. I missed meeting you before we jumped on, but my name's Dylan and I'm the program manager for School of Public Health. And since we have a little bit of time, I was wondering, in your opinion, what are like the most pressing challenges and opportunities do public health students face today?
Definitely this year, job. Because this is not a good year to be graduate, 2025, given that so many colleagues are around because of closing down of USAID or CDC or NIH. The second challenge, I would say that the public health, I think that's what I was trying to, that if the MPH program would have an experiential component, experiential semester, which would have helped student in the job market more than rather than only attending the theoretical class. So one challenge I find, that's particularly the students without experience. I don't know about the America market, but when I was in Germany and Bangladesh, I recruited a lot. This disconnect between the theoretical knowledge and the real life scenario. So, and the MPH program, most of the MPH program very much class-based. More and more, I think nowadays, the MPH students are lucky. When I did my MPH, the case study based or problem based solution or case study lecture was not much available. It was all theory. So that's one of the challenges. The final challenge, I would say, that what type of job, we discussed about that, what type of job they will be looking for. Whether, and I suggest all my MPH graduates who are graduating this year, I told them that you don't need to be get paid. If there's a job market is bad, just go for start working as a volunteer, unpaid, because don't sit at home. Try to be engaged on whichever way you can. Take it as an opportunity, because your experience will not be limited to what job you got. So you can go to the community-based organization and 3 months, like, or health facility. Yeah.
Yeah, I think that's great advice, because I think sometimes there's this mentality surrounded by, as soon as you graduate, you have to immediately land a job or be doing what you went to school for. But I think you touched on it earlier. If you don't have that opportunity right away, there's chances to volunteer and just become a part of the community. And I think
Yeah.
then you get into networking, and then that's where, maybe
That's
job
also different
opportunities come from.
opportunity. You can work on the data, you can write a paper, so this is also, to me, it's an opportunity, different kind of opportunity.
Yeah, absolutely. Yeah, thank you for sharing. And I have one more question. How have you approached decisions about taking the next steps in your career, and how have your interests either remained the same or changed over time?
I always prioritize what is important in my life. So my career, after finishing the master's here, I had a fellowship, but I went back to Bangladesh with my son. Then when I was in Germany, my parents were aging. So I left Germany, went to Bangladesh and started working there. So I'd say that there is a luck in, because I just went with the flow. And whenever something came, so it might sound very romantic, but I tried to go with the flow, and whatever came to me, I tried to enjoy that. So when I was in Germany, went back to Bangladesh, and I enjoyed that. I tried to enjoy. Then I had an offer from Brown, which was also very unexpected, and I'm enjoying that. So that's why I gave that example, that on the ladder, that focus on the step you are in, and then do your work. And if there is a pinch of serendipity, or if there is a luck, but try to enjoy whatever. But frankly speaking, I never planned anything. I never had
Yeah,
that target that I want to reach. I wanted to enjoy my work, what I'm doing, to enjoy
I love
that
that.
work. So
Yeah, I
every day
think
I
it
want to
can.
be excited that in the morning that I'll go for work.
Yeah, that's
That was my
great.
goal.
That's good, because I think, right, sometimes too, it's really easy to get wrapped up in like your end goal, and you kind of
Yeah.
forget to enjoy, living
No,
in the
you don't
moment.
enjoy,
And
and then you don't succeed. There's a question
yeah,
from Whitney. Yeah, you
yeah,
raised
yeah.
your hand. Thank you, Dylan. These two are very good. All questions are very interesting and provocative. Whitney?
Yeah, thank you so much. I'm a Master's of Public Health student, hoping to graduate in either fall 2026 or spring 2027. Just looking at your experience, I'm really interested in your experience in Germany, and were you actually studying in German, or is that an English language
No, it
program?
was English. It was English. So it
Oh,
was
okay.
University of Heidelberg, and that was also because after my MPH at Harvard, I got admitted for my PhD at Harvard, but I decided not to do that because they gave me tuition waiver, but they said that you have to work full time, and my son was 12, and I decided no, doing a PhD at Harvard and full-time work with this, being a single mother. That's not a good idea. And my PhD supervisor, she was very fond of me. She was very upset with me. She said, "Oh, do you know that? Why are you like, it's such a one in a lifetime chance that doing a PhD at Harvard." I said, "No, I already have a Harvard degree." So I went back to Bangladesh, and she went to Germany, Heidelberg, and she asked me to go back and then do my PhD with her. And I said, "I can't do that full-time PhD." Then she said, "Okay, 50% you will work with me and 50% you'll do your doctorate work." So she's a wonderful mentor, Rachel Snow. And she mentored me. And I was lucky. I went to Heidelberg, one age to another age. You see that from Heidelberg to Harvard to Heidelberg, and then from Bangladesh to Brown, all this B and H. And then and then I did my doctorate work in Burkina, and after PhD, I joined as a postdoc, then junior lecturer. Yeah.
Thank you
And
so
it's in English. In Germany, the Heidelberg School of Public Health, Institute of Global Health, Munich, Berlin, all PhD and masters are in English, not in German.
Thank you. Sorry to be off camera,
Yeah.
and thank you for your answer. I'm cooking. Like, I appreciated your reference to cooking earlier and people. I really resonate with that. And I'm sorry to be off camera because I'm doing that myself right now.
Yeah, but you want to apply for PhD, you can apply in PhD in Germany too. They have several good schools. Yeah. Dana, you wanted to ask a question?
Yes, hi, Dr. Sarker. I'm Dana Marie. You can call me DM. I'm a researcher at the National Renewable Energy Lab. And so, like you, I'm interested in this whole thing about translating public health research into impactful community-based type programs. So one of the areas that I deal with is agrivoltaics and helping rural farming communities around food security and energy security, which can be like a very complicated, complex topic. So I'm wondering if you just had any insights in based on your expertise on how you can communicate like complex topics when you're trying to do like community participatory type style research.
Yeah, the food security, because it depends on what do you want to communicate. What exact message because sometimes we should not overload the implementer and the policymakers with all our knowledge. So if you have a goal and objective that you want the policymakers to, so like a food insecurity or food, think about you want the policymakers to have a labeling of the food, that which is sweet beverage or so you need to think about what is your objective, what do you want that policymakers or implementers to do, and based on that, you need to kind of adapt a message or create a creative, what should I say, that a creative knowledge translation output, whether it's an infograph or video or a talk show. But most important thing is that you don't want them to understand all this basic or all this nitty-gritty of the technical knowledge of the food security. So first, I think as a researcher, that's an expertise or that's an experience that you can think about, that what do we want to communicate? What is my goal through my comments? So for example, so I communicate, so there's a kangaroo mother care project, like in Bangladesh, they wanted to scale it up. So kangaroo mother care, I don't want to go the technicality. We looked at we evaluated the implementation research. And then element, I found that the capacity building, the training of the health worker, but also communication with the mothers, how to do the kangaroo mother care, these two. And then we did a video on that and shared with the Ministry of Health that can we start a refresher training, and can you develop the communication material? So depending on what research you do, identify what needs the new policy formulation or policy adaptation or policy change, or for implementers, something in the field that they needs to do. And that information think about how can you communicate with the person. And the best thing, if it is in the USA, the RR with the policymakers, I found it very helpful that I did the breakfast meeting. So the ministers and in the Ministry of Health, so take them from a breakfast meeting and then just discuss that over breakfast.
Thank you so much, Dr. Sarker.
Any more comments? Or-
Yeah, do we have any more questions?
For me,
Or I was just asking in general, just the,
okay.
yeah.
No, but but I do think that this is a very interesting initiative for online page program that talk to different public health leaders and share their experience. Again, the sharing the tacit knowledge. So I appreciate this program, and I hope that those who are present today, that few that you kind of capture or learn few things from my experience. Yeah, that's the outcome that we're expecting.
Yeah, definitely.
Yes, absolutely. Thank you so much for your wisdom.
Thank you, and thank you for inviting me.
Yeah, absolutely. I'll say thank you, Dr. Sarker. Thank you, both of our moderators. I think it was very insightful, and we appreciate your time. And thank you for everyone who attended. And have a great night.
Okay, you too. Thank you
All right.
so much. Thank you, everybody.
Thank you.
Lovely
Bye.
meeting you.